Hi, everybody. Thanks so much for joining us on today's Prezi about using TOP in FTDM and YTDM meetings. We're here today to talk through a couple of different things related to TOP. First, a little background information about what TOP is, how TOP's being used in Iowa, and what the population of kids that TOP is being used for. Then we'll talk about preparing to use TOP in FTDM and YTDM meetings. So what are some of the things that you need to know about TOP going into those meetings? How can you use it to incorporate TOP into the meeting? And then we'll go right into some practice of different scenarios where TOP can be used, some examples of actually how to speak to TOP in a meeting. What is it that you say? How do you bring it up? And then we'll end with some helpful tips that you can take with you to move forward into facilitating these FTDM and YTDM meetings. If you have any questions throughout the Prezi, please feel free to jump in and go ahead and ask me, and then there'll also be some time for questions at the end. So understanding TOP as an agency tool. So again, this is about what it is that Iowa wants to do with TOP. What is the population that we're using TOP on? Iowa, DHS, and JCS are really using TOP as a tool to better understand the well-being of children in care. So again, we're going to go through an intro. Step 2 is talking about the preparation piece of getting ready to present TOP in FTDM and YTDM meetings. How do you do that? Step 3 is about practicing that piece of it, and step 4 is the helpful tips. So the first piece that we like to talk about is who is Kids Insight. So Kids Insight is the organization that implements TOP, the treatment outcome package, into states and jurisdictions across the country. We are a nonprofit that's dedicated to improving outcomes for kids in both child welfare and in juvenile justice. Really, the goal of TOP is to improve placement outcomes and also improve the well-being of the children that are in these systems. If you want to know more about Kids Insight, we do have a website. Please feel free to visit us there. You can also go to our YouTube channel, Kids Insight, and there's a lot of really great videos on there from sites that we've worked with currently and in the past, where you can find some testimonials and some stories about ways that other places are using TOP. Hear from kids who had used TOP when they were in foster care and how they feel about it. There's a lot of great stuff on there. So what is TOP? What is it that we're talking about here today? So TOP is a behavioral assessment that measures and tracks psychological and behavioral indicators of well-being for children over time. So it marks progress. It understands how a child is doing at one point in time and then how they're doing it at a different point in time through a questionnaire that multiple people fill out, and it's given to people, and you just fill it out, answer the questions, and it helps to understand based on behaviors, based on interactions, based on experiences with the child, how that child is doing. So TOP creates a 360-degree snapshot of the child's well-being and behavior by asking different people and significant people in the child's life to fill out that same questionnaire that I just mentioned. And this is done at regular intervals. So that's the way that we're able to track the child's progress over time, track their well-being over time, and see whether or not the services and supports that we're providing a child are helping the child's well-being improve. Is the child regressing? What do we need to do about that? How can we help that? So as I mentioned, the TOP measures well-being and measures well-being indicators, which we call domains. So these are areas in the child's life and behaviors that look at a child's well-being and help us to understand how the child is doing, whether it's with conduct, whether they're behaving appropriately with friends, if they're acting depressed, or if they're reporting themselves as being depressed. All of these different things are scored on on a multi-rater report, which we'll take a look at in a little while. And they are plotted in the ranges healthy, mild, moderate, and severe. So you really get a good look at what's going on with the youth.
I have a question.
Sure.
Is the top ever used to diagnose our clients and the children?
It's not. So the top does not give you a diagnosis. It's not meant to replace work that's done with a therapist or that's done with another professional. Top is really looking, it's really wants a snapshot of what's going on right now, recent behaviors that the child is exhibiting, to better understand where they may be struggling and to better understand where we may be able to provide some type of service or support to help them in that area. The domains that we include on the top and on the multi-rater report are ones that we know are specifically related to the overall well-being of the child.
Great, thanks.
Yep. So who is top completed on? So in Iowa, children aged 5 and older placed in out-of-home placement where DHS or JCS has responsibility for placement and care. That is the target population. Those are the youth that a top should be completed on every 90 days while that child is in that placement and care. There are other circumstances that the assigned worker or the supervisor may feel that it would be appropriate to complete a top for a child that doesn't fall into that category, and that's totally fine. Maybe a child is really struggling at school and it would be helpful to try to figure out what's going on. Maybe it's something at home, something of that nature. Any time that you really need more information about what's going on with a child, the top can help to gather that information. So top is completed by individuals with a significant and recent relationship with the child. These people are known as raters. They really, really have a lot of good information about how the child is doing. They interact with the child on a regular basis. There are people who see the child regularly. There are people who can really help us to create that 360-degree perspective. So I mentioned raters, and the DHS worker who's responsible for administering the top will, first they're going to complete the assessment. Once they do that, they're going to think about who are the relevant people in this child's life. Raters may include the child if they're over the age of 12, the birth parents, foster parents or caregivers, therapists, other professionals working with the child or family, and other people with important relationships with the child.
Quick question.
Mm-hmm.
Can other people who aren't on this list be invited to participate, like, say, a child's teacher?
Absolutely. So the way that we look at raters is sort of there being two categories of raters. We have primary raters and then other raters. The primary raters are the people who the state has decided need to be asked to participate in the top. So those people in Iowa are the youth themselves, the birth parents, the family and placement provider, or the placement family / placement provider, the therapist, and the DHS worker. In addition to those people, there may be individuals who have a really important relationship with the child. So given your example, a teacher, we all know that the teachers spend a lot of time with the children. So that teacher may help to fill in a missing piece of the puzzle for this 360-degree perspective. So teachers can absolutely be asked to participate, basketball coaches or mentors or big brother, big sister, any type of person who interacts with the child on a regular basis and may provide some really good information would absolutely be on the list of people to invite.
Thanks.
Yep. So what does the process look like for the DHS worker? So once they've completed their top for that child, they're going to identify those raters. And once they've done that, they're responsible for providing the rater with an explanation of top. One of the things that we found is that if you don't explain to somebody what it is that they're being asked to do and why it is that they're being asked to do it, it's less likely that they're going to want to participate or find the time to participate because they don't really see the value add. So the DHS worker is going to go ahead and explain TOP to these different people with the hopes that it will encourage them to participate. They'll then provide the TOP, the questionnaire, to those individuals in one of 3 different ways. Most often in the beginning, the TOP will be provided to those people, to the raters, in paper form. So the DHS worker will give it to them on a home visit, or whenever it is that they see these different people, and will ask the rater to fill it out. So maybe during a home visit, the foster mom fills it out while the DHS worker is talking with the youth, and then they switch off, and while the DHS worker is talking to the foster mom, the youth may fill it out. There is also the option to email the link to the rater to complete the form. This may be used with therapists, but it does require some introductory information, but that comes right out of the system. And then the third way is to ask the rater to complete the TOP in their office, either on their laptop or on their tablet. If they have a tablet out in the field, they may ask somebody to participate there. That's always also an option. The next thing that they're going to do is ensure the results are in wellness check. If the link has been emailed or has been done on the worker's computer or tablet, it automatically goes right into the system. But if it's done on paper, the DHS worker will go ahead and fax it back to make sure that everything is in there. And then once 1 or more people have completed the TOP for that child, the DHS worker can then produce a multi-rater report, which shows everybody's answers, everybody's scores on one easy to read sheet. So we'll talk a little bit more about the multi-rater report in a little bit, and we'll actually walk through one and talk through it. So again, today is really about putting the pieces together. It's about understanding what TOP is and why we're using it in Iowa, and then it's about understanding how to use it and how to facilitate a meeting with facilitate an FTDM or a YTDM meeting with TOP incorporated within it. So next up is preparing for an FTDM, YTDM meeting using TOP. The first thing that you're going to do is determine whether or not the case that you are facilitating the meeting for is eligible to have a TOP, whether they've had one or they should have one. So is the child 5 or older placed in out-of-home care? If the answer is no, it's not necessary to consider TOP. If the answer is yes, what you're going to do next is ask the DHS worker for the most recent multi-rater report. So the DHS workers will have access to the system, and they can go in and print the most recent multi-rater report. The TOP is completed on a 90-day cycle. So every 90 days, the DHS worker completes their TOP form, and they complete a new TOP form, and then they ask the raters to participate. So there should be one relatively recently available. If it is more than 90 days old, or there's been a significant change, so if the child has left their placement, or there's been a significant life event for the child, you should definitely ask the DHS worker to have an updated TOP completed in advance of the meeting. Because we really want to be focusing on current information. We want to know what's going on here and now with the child, and something that is from 3 months ago may not provide us with that updated information that we need to support and to better inform the decisions that we're making in this meeting. So once you've determined that it is a TOP eligible case, we want to talk a little bit about how to incorporate TOP into preparing for the meeting. So whether it be reading the case notes and stuff like that, how do you fit TOP in there so that you can talk about it in these meetings? So the first thing that, once you've talked to the DHS worker and gotten a copy of the multi-rater report, the first thing that you're going to do is to review that multi-rater report. So once you're reading the multi-rater report, what we're going to do here is I'm going to walk through some steps to reading a multi-rater report, and then we're going to take a look at an actual multi-rater report and kind of use these steps to guide the conversation that we're having around that multi-rater report. So the first, and I think to a certain extent most important thing, is to pay attention right off the bat as to whether or not the child themselves has rated. Again, 12 and older, the child should be asked to participate. So take a look in the key that's on the multi-rater report to see whether or not the child has participated. It will always be a green circle for the child. The child is best equipped and best knows what's going on with themselves and how they're feeling, and things that they're doing, and how different things are affecting their life. So what they say on the multi-rater report is really critical to look at. Once you've looked at the child's scores, if they've participated, you also want to look at strengths and challenges. So are there areas that people are agreeing that there is a lot, that they're agreeing that it's a strength for the child, so it's in the healthy range for that domain? Are people agreeing that it's in the severe range for that domain, which would be, a significant challenge? Look at agreement and disagreement in terms of whether or not people are agreeing on either side of it in a particular domain, or if there's a lot of disagreement. Are the symbols close together in either healthy or severe? If there's a long line, so I'm going to flip now to the multi-rater report. If there's a long line between, as you see here, for psychosis, if there's a long line or a long blue line or a long tail in between two rater scores, that's indicating a significant disagreement. So those two people are saying different things about what's going on. In this particular case, that is the foster parent and the client themselves disagreeing about what's going on with the client in the domain of psychosis. Other areas that are important to note here is, number one, there are a lot of really good agreement around the healthy range for the child. So a lot of people are agreeing that things are going pretty well for this child. The other one that's interesting on here is social conflict. And that's interesting because it looks as though there is an indication that the public worker knows that something is going on, maybe with friends or with other individuals that the child spends time with. But the child themselves is indicating the most severe of those things. So it may prompt a question. It may create a discussion that you want to have with the child about what it is that's going on.
I have a question.
Sure.
So if the birth parent rates and they're rating the child in the severe range or in the red range, but they haven't had any contact with the child for a while, what is that telling us exactly?
So that's a really great question, because the raters, generally speaking, for raters, we're looking for people who have had an interaction or a relationship with the child within the last, say, month, because that's the time period that the questionnaire will ask for. But the birth parents is a little bit different. The reason that the birth parents is different is because we always want to encourage parents to participate. We always want them to feel like they have a voice. We want them to be included in the conversations. And we know that sometimes their level of participation and their level of involvement can change from time to time. So if you have a parent who has rated and you know that they had not seen the child, we just want you to take that into consideration when you're looking at the report. So their information may be a little bit out of date. It may not be current information about the child's well-being, but we always still want to encourage them to participate, because we don't want to be sitting around the table having a conversation about their child and they haven't been you know, they haven't been asked to be involved in this particular process. Any other questions on the multi-rater report? Okay. So once you've had a chance to review the multi-rater report and to think through some of the information that's in there, the next important step is to include this information in your prep notes. So based on what I just talked you through in terms of reading it, think about areas that prompt questions for you. So what is it that seems interesting about something in particular that you're seeing on the multi-rater report? Based on your understanding of the case, what makes sense and what doesn't make sense? Where do you have additional questions that you need to ask? Where do you know, what makes sense and what doesn't? Incorporate these questions into the prep notes so that you can refer back to that information in the future and you know, use that in the meeting that you're having. So these are different scenarios, different situations that may that may be relevant when thinking about where TOP can provide more information for. So think about, have the child's behaviors been a challenge at school or with a caregiver? What information can we derive from TOP that would help with that? Has the parent or parents struggled with the child's behavior? Are they currently struggling? What does the TOP tell us about the child's current behaviors? How does that relate to what we know about the child's behaviors in the past? Was the child's behavior a factor in the out-of-home placement? If it was, how has that changed? How has it evolved over time? Is the child progressing? Are you worried about a possible placement disruption? So is that something that's on your radar? Is that something that you're thinking might happen?
I have a question. You just mentioned placement disruptions. How could TOP help the team to think about those possible disruptions and address that?
That's a really great question, and there's actually a lot, kind of a multi-part answer to that question. So TOP can help and can be really helpful in both noticing that there may be an issue with the placement and with handling placement disruptions. So over time, one of the things that we've learned about TOP and what is on the multi-rater report is that there are a couple of domains that you can pay attention to better understand what's going on with the child and better understand what's going on within the home. And that, for younger kids under the age of 12, that is the resiliency domain. So what you want to pay attention to with the resiliency domain is where it's scored by the placement family. The resiliency domain is a lot of questions around how is the child behaving in the home, does the child follow directions? Essentially questions around, is the child easy to live with? And when the placement family, when the caregiver is indicating that the resiliency is in, you know, the mild, moderate, or severe range, that usually means that the foster parent is saying that the child is not easy to live with, that they're struggling to you know, to keep the child in the home. So whenever that happens with the younger kids, we always recommend that people reach out to the foster parent to see how they're doing, how they're feeling, how are things going, see if there's anything that they can do to possibly prevent a potential placement disruption. For the older youth, there are other more overt behaviors that indicate there might be something going on in the home, and those are things more like social conflict, violence, conduct disorder, stuff like that. Things that, you know, those are also really difficult behaviors to manage, and if a foster parent is indicating that those are challenges that they're currently experiencing, that's something that, you know, they may be saying that they're really just having a hard time. The other place that the top and the multi-rater report information can be really helpful is when a placement disruption occurs. It can be helpful to provide information to a potential or a future placement about what's going on with the kid right now. What is it that they can expect? What might some of the challenges that the child exhibits right off the bat be? And just to really prepare somebody, to give them more information, and to just be very clear with what's going on. Does that answer your question?
It does. Thank you very much.
Yep. So the last one is, has the child moved to a higher level of care, or is a higher level of placement being sought? What is the top telling us about the child's behavior? It may be saying that, in fact, a higher level of placement is needed for this child at this time. But the other really nice thing about the top is that you can also then track that child's progress and see when the child is back to a place where their behaviors may be better managed in a less restrictive placement. So this is a really important thing to think about and to remember. The multi-rater report is not going to be distributed during the FTDM, YTDM meeting. The other people at the table will not receive a copy of that. Because they're not going to receive a copy, it's really important to both work with the DHS worker and to think through together how to incorporate the information. It's also really important to include the information in your prep notes. So, just making sure that you jot down all of the stuff that you need to know in order to help guide the discussion about TOP once in the meeting.
Question, if I can't show people at the meeting the report, how am I supposed to remember what it says?
So that's one of the things that is really important. Again, as I just mentioned, the taking notes and the collaborating with the DHS worker is really important to help you remember what it is that's important. You want to include different things, such as the scores that somebody had. If there was an area of a lot of agreement or an area of disagreement, who was it that is on either end of that blue tail? So who is it that is seeing things in wildly different ways? Because you can address that with those people and you can explain that to those people. And it may also be helpful to have a conversation with the worker about what types of things have been going on lately, because that will help to provide some context for the scores, and it may make you say, that makes sense that person scored that way.
Okay, thanks.
Yep. So again, a little bit more about collaborating with the DHS worker. Now that you've had the chance to jot down some of your thoughts, you really want to take some time to have a conversation with the DHS worker to bring out any information that you consider to be highlights or concerns or questions that you had based on what the multi-rater report said, to get a better, some backstory, if you will, to what's going on with the case, so that there may be things that make sense after you talk to the DHS worker. There may be things that no longer make sense that did before, once you talk to the caseworker. Decide if there's information that requires special attention. This doesn't necessarily have to be negative. So special attention may be given to areas where the child has, maybe they've made a lot of progress from the last TOP. Maybe they have like a ton of strengths on the TOP, and that's, those are all really great things. You also do want to bring attention to anywhere that the child is really struggling, and it's a domain that's seen as a challenge, because we want to think about how to best support that child and what that child needs in order to overcome some of those challenges that they're having. The last thing that you want to do with the DHS worker is to think about the purpose and the goal of the meeting. So to really start thinking about where TOP best fits, where it fits into the conversation, where there's a natural place that you can insert some of the information from TOP, just it's not having it be sort of a separate thing, that is done in the meeting, but how to really truly incorporate it and integrate it into the discussion that you're having. So building TOP into the meeting outline, here's just some examples of when and how to incorporate TOP, so different parts of the process. So during the time dedicated to discussing the child's strengths and needs, this is really critical because TOP, lays all of that out right on the page for you. You can see where everybody agrees that the child is in the healthy range for any number of domains, and that really speaks to that child's strengths. That really speaks to everybody's perspective on what's going on with the child. And then with the needs, you can look at the challenges that the child is having, and you can better understand what their needs are based on some of the challenges that they're having. What are some of the things that you can do, again, to better support this child? The next one is during the discussion of the family functioning domains. Family functioning can be explored with the TOP because it can provide a really good a segue into the difference between parents and how parents are possibly viewing the child differently than other people, how the child and the parents are seeing things different, between themselves, and really help to start exploring why that's happening and what is it that is making one person see something one way and another person seeing it in a very different way. The last is during the development of the family's plan and notes. So talking about TOP in terms of, what are we going to do moving forward? What's our next steps? What's our plan going to be for this child or with this child? Just really talking about what it is that you're seeing on the TOP and how that relates to what the best next steps are.
So I have a question. Are these the only types of meetings that you would use TOP in?
Definitely not. TOP can the really unique thing about TOP is that it can be incorporated into a wide variety of meetings. It's, there's a ton of different ways that you can work it into the conversation. It provides really great information. It provides a really great jumping off point for asking questions about what's going on in certain situations. It's designed to give you answers, not to give you answers to what's next for the case or what to do in a certain situation. It's helps you ask better questions so that you better understand what's going on with the case. Anytime that you think you need more information about what's going on or how the child is doing, the TOP is absolutely the place to do that.
Thanks.
Does that answer your question?
Yes, it does. Thank you.
Great. Okay. So the next thing that we're going to talk about is introducing the actual practice piece of things and introducing TOP in the FTDM and YTDM meeting. What we want to review first is kind of the purpose of some of those meetings and areas where TOP fits in really nicely. So case planning. What are we going to do next in a case? What information do we need to make decisions about what to do? Interaction planning. Where are there differences between what people are seeing? Is there, something that we need to talk about with the parents in order to continue planning for interactions? Conflict resolution, be it between the youth and somebody else, be it between two of the different parties who participate, really putting that out there. And the final one is case closure. So what's going on with the kid now? How do we maintain this? And, if we're closing the case, how do we move forward knowing that the child has what they need to, successfully have the case closed? Similarly, there are different purposes of the YTDM meeting. So here are some examples of that: engagement and stabilization meetings, transition meetings, preparation for adulthood. One of the things that we find when it comes to youth preparing for adulthood and preparing to, continue on into the world is that it's really helpful for them to see their strengths on paper and to be able to understand how other people perceive them. It's also really helpful for them to understand how the way that they decide to behave, the way that they choose to behave affects people's perspective. So when they're able to see that a certain decision resulted in a change in perspective of how they're doing, that's very helpful for them to, to understand consequences and to understand what to do moving forward with that type of information. What are some ways that I can bring TOP into the conversation? So how do I really talk about TOP? What do I say? What is it that, what do I say? So the first is challenging behaviors. So here we have a case scenario that is just an example of a case, and then there's a quote here, and this is really just how you would talk about this. So here we have Jason. Jason is living with Aunt Irma and Uncle Charlie. His behaviors lately have been particularly challenging. His aunt and uncle are really unsure of whether or not he is going to be able to stay with them. As a facilitator, you could say, some of you may remember filling out a questionnaire called the TOP, asking about Jason's behaviors and well-being. Today, we're going to talk about what the TOP said and whether the information helps us think differently about next steps for Jason. So that's a way to introduce in the conversation about Jason's challenging behaviors and what's going to happen, where Jason is going to live and remain, introducing the TOP into that conversation. The next example is about celebrating some successes. So this is Lindy, and she's living with her grandma. And the previous TOP that was done for Lindy, really everybody at the table indicated that she was struggling and having some significant challenges with aggressive behavior, some violence. Everybody really agreed that that was a challenge, and it was, taking its toll on grandma. So as a facilitator at our last meeting, we talked about Lindy's aggressive behavior and how that was affecting everyone. Through our discussion, we were able to help her find an outlet for her aggression. Based on the latest TOP, Lindy seems to be doing a lot better, and everybody here agrees. Grandma, it sounds like things are going well at home, and visits with mom and dad are also more positive. Let's take some time to recognize the progress that Lindy has made. Again, we want to celebrate the successes. We want to find places where there are strengths that we can both recognize and capitalize on, and this is a really good example of using the TOP and marking progress and change over time. So this is an example. This is the children are staying with foster parents, and the parents are really trying to get their interaction schedule back on track. But what happens when they have interactions is they wind up struggling a little bit when they get back home. So as a facilitator, what you could say to bring the TOP into the conversation and just kind of start that conversation about what it is that we're going to do next is, I know one of the goals for today's meeting is to discuss the interaction schedules, but we also know that these interactions have been very stressful and it's causing some difficulty within the foster family. Susie and I would like to better understand what's going on, so we're going to compare both kids' TOP results to when they first came into care until now. This way we can better understand how their needs and behaviors have changed and try to get a better understanding of how they're doing and how we can best support them. So using the TOP over time to understand where they were when they came into care, where they are now, and how that's being affected by either positively or negatively by interactions that they're having with their parents, and really getting a better understanding of what's going on in that situation. The fourth example that we have is about transition planning and about a young man named Eddie, and Eddie was placed in residential treatment, and they did an initial TOP on him, and then they continued to do TOPs, but he is now transitioning out of residential, and we want to see what's going on and also understand what we need to do to support him. So as a facilitator, you could say, wow, what a difference we see between Eddie's first top and the one that we did last week. It's really great to see that improvement in Eddie's behavior as a result of his hard work. Let's take a few minutes to think about what else contributed to Eddie's significant improvement and whether there are things we can do to help support him now that he's going home. So one of the things that we know is that, particularly in this instance, Eddie put a lot of work into improving his behaviors, and he made the choice to behave in a different way than he was previously behaving. But we also know that with something like a residential program, there are also other things that can contribute to that. So in this scenario, we want to think about what those things are. So it could be that when Eddie was living at Smith, he had a very structured, very regimented schedule that he was living by, and that helped him with his behaviors, and that helped him to control his behaviors. So moving forward, we want to think about whether or not talking to mom and dad about having a schedule, having a structure for him in the home is going to help him to maintain his improved behaviors and make sure that he doesn't come back into care because we haven't supported that progress that he's made. Include TOP when applicable into the development of the family or youth notes at the conclusion of the meeting. It's just a good record for how you used that information. You want to keep track of how you use the information, what information it helped you to, or what decisions and what planning that it helped you to think about as in terms of the TOP information and in terms of what types of information you picked from the TOP. Remember that TOP is not going to give you specific answers. It's not going to tell you exactly what to do. It's not a roadmap, but it will help you to see the mile markers. Again, TOP tracks youth over time, and it tracks their progress and maybe not so much their progress over time. And so it helps you to understand how things change, over the duration of the case. So some helpful tips. Again, these are the types of meetings that TOP provides some invaluable information on. These are not the only types of meetings that you can use them in, but you might want to, specifically these types of meetings, you might want to think about really think about how the TOP fits into the meeting. TOP is descriptive, it's not diagnostic. It's describing behaviors based on observations of people, interactions that they're having with the child, and it's their perspective, it's their understanding of what occurred, it's their understanding of what's going on. Use the information from the TOP to inform the discussion, recognize the successes, and identify the concerns. So, we talked a lot about this. Recognize and celebrate the successes that youth are having. Celebrate places where they have, a lot of agreement. Help them to see that, they may be having some challenges, but there are other places where there are a lot of people around them that agree they're doing really well. Identify concerns. Concerns may be disagreements between two groups of people or two particular people. Concerns may be things like in the multi-rater report that we looked at, the child is self-reporting psychosis. That's a concern. That's something that you want to bring up with the child. You want to have a conversation, with the DHS worker, to have a conversation with the child about that. Just really use the information. Helpful tips for sharing TOP. So the DHS worker is going to introduce TOP and be a part of that discussion. But again, you guys and the DHS workers should really work together to be on the same page, essentially, and also to guide the conversation. So exploring what possible meanings are of different ratings or agreement or disagreement. So examples of that are, why does the foster mom feel like Billy is depressed, but no one does? No one else sees that Billy is really struggling, but the foster mom is indicating that she thinks that Billy is depressed. What's going on there? Why is Angel the only one who sees herself as functioning poorly at school? Is there somebody else that needs to be invited? Maybe the DHS worker can reach out to the teacher and see what the teacher's perspective is on how Angel is doing. But what is it that's going on at school that, you know, is causing Angel to feel that way? Just for the FTDM YTDM meeting will help the DHS worker and facilitator be on the same page. Remember, only the DHS worker and you, the facilitator, will have a hard copy of the multi-rater report. The DHS worker and facilitator should work together. That's really, I know that we've said that a lot, but that's really critical to, you know, to talking about it and to being comfortable to talk about it in the meeting. It may be helpful to seed the discussion by identifying in advance a few points from the multi-rater report. You can put those in your notes. You can put them, you know, you can just jot them down. Charlie, I noticed that everyone thought you were doing very well when you're at school. That's really great to hear. That may prompt a discussion. It may prompt a conversation about, you know, how Charlie's feeling and how school's going and, you know, stuff like that. So that's the last of the helpful tips. And then one more important helpful tip is if you have any questions or, you know, need more information about TOP as a facilitator and using TOP and in these facilitated meetings, Mindy Norwood is available to answer your questions and to kind of guide you through anything that you may need to know, or, you know, just anything that will help you move forward with facilitating a meeting involving TOP. So are there any other questions that anybody can think of? If not, thanks for joining us. I hope you guys all have a great day, and we'll talk to you soon.